My name is Simo Hosio. I'm an associate professor at the Center for Ubiquitous Computing at the IT faculty, and I also lead the crowd computing research group in the same center. Today I'm going to be talking about navigating the future of something that I call crowdsourced healthcare. And of course there's a lot of things about the future itself, but the one thing that strikes me always as a kind of an odd fact about the future is that it's nothing more than a story. Anyone who claims that they can tell exactly what's going to happen in the future are either overconfident or somewhat delusional, because we know that nobody can forecast the future. Otherwise it would be a bit too easy. The way humanity and researchers too, the way we construct our kind of images about the future is through stories. Humans are really good at creating stories, and stories are the kind of fabric that makes our mental images of what is the future. And even before we can start to make some kind of forecasts or guesses about how does the future work, we need to realize the fact that they are really never that accurate. If we look back in history, we don't even know what is true now. Just some time ago, we were thinking that there are canals on Mars indicating civilization, or that 4 elements dictate everything that is: earth, water, air, and fire. So it's only pretty logical to think that whatever we think is true right now is based on these kind of beliefs or stories that we tell to ourselves, and they are just simply not true. Sometimes, however, we are pretty good at forecasting what's going to happen in the future, and I find that especially in the realm of technology, things like that are presented in science fiction are sometimes a great motivation to try to make guesses what's going to happen in the future. Look at this, for example. We know that in Star Trek we had this tricorder device, which is essentially a device for sensing, recording, and computing. And look at that thing. It's like a handheld device that is very good at computation, data recording, data analysis, hence the word tricorder. What do we have these days that is pretty much exactly like this thing? The iPhone, or smartphone in general. Everyone carries these things, and they are super capable devices in terms of computational power and sensing, recording, and computing. So instead of thinking of these devices as devices to do funny TikTok dances or consume TikTok or Instagram or just call your friends, we as researchers look at these devices as programmatic interface to crowd intelligence. It's a super convenient way to access people and access their thoughts, access their objective mobility patterns, just access a lot of objective as well as subjective data about large crowds of people. And then when we know how to model these people, we can start building services on top of that intelligence. That is exactly what my group is trying to do here at the University of Oulu. So we call it the crowd computing. And by crowd computing, we refer to all kind of activities that revolve around somehow modeling a crowd of people, learning from that crowd of people, because in the end, all knowledge, one way or another, either directly or indirectly, originates from humans. So if we can model crowds of people and learn through their activities and their opinions, we can start to build helpful, useful end-user services. Over above everything else, we focus on digital health research these days. And we approach this through 3 different sub-themes. One is data management. We all know that these mobile devices, they help us gather and collect, and they also generate a lot of data about everyone. But usually that data is vaulted behind some big technology companies' vaults, and it's a bit difficult to access that data sometimes for researchers and nonprofits. So we're trying to build better data management models and just understand how do people themselves consider about this data. How do we get access to that data as researchers? Then we build better crowdsourcing tools. What kind of tools do we need to gather that information from the crowds of people so that we can finally ascend to the final target goal that we have, which is end-user digital health solutions? Based on this data that we gather with our own tools or somebody else's tools, better crowdsourcing tools, what kind of solutions can we build for the end user so that they can see benefits in their daily life through this 3-tier process? Now, before we go into each of those 3 layers, I just want to talk about one specific methodology that we have been using a lot, and that is crowdsourcing. There is a lot of other things to crowd computing in general as well, but crowdsourcing is this basic method that we have been employing for maybe at least 15 years now in our research. And it's a machine with a human inside. So we have this method that deals with parallelizing work and collecting a lot of data and then building computational solutions to aggregate that data into something that makes sense. A good example is, for example, Wikipedia. So if you think of Wikipedia, what happens there is that we have multiple different parallel editors who are contributing individual nuggets of information to a given topic. And then there is a half human, half computer process of aggregating that. We have different moderation algorithms, and then we have just moderators itself to construe this kind of a big constellation of information from these small nuggets of information. And another example is, of course, if you work in areas like machine learning or AI, you need annotated data. Who does the annotation? The data doesn't come from nowhere. So it's usually through these kind of online platforms where sometimes hundreds of thousands, the biggest ones even have millions of people in the platforms doing this data annotation work for you. And now, because we have this AI boom, machine learning boom, these platforms have been seeing a lot of action lately. It's a big business these days. All these new AI algorithms, machine learning algorithms, are very data hungry, and that data, like I said, don't come from nowhere. So it's these people in these platforms who are annotating millions and millions of microtasks per day to train these algorithms for companies. Now, there are some issues here. Even though it grants us this kind of global access to a lot of people programmatically, as I said earlier, it's very convenient. But the crowds are growing really fast. And you can imagine that these platforms are not perhaps the ideal places to work from the human perspective of the people working through these platforms. It's a lot of poorly paid, really nasty job at some points. You think like content moderation in places like Pinterest or Instagram, you are going to see a lot of image material that maybe you wouldn't want to be seeing as your main job. You get paid like some dollars per hour to see images like child animals doing things that animals are not supposed to be doing, really nasty stuff. And all the big companies are using these behind the scene in a way. Everybody remembers OpenAI, ChatGPT. Likewise, they are using Kenyan workers to moderate and train their algorithms where they have really horrible graphic descriptions of what's going on. And some of these people, they end up ruining their lives. And the companies are not doing their job of actually offering them like a proper working conditions. So this is the harsh reality that is going on in these platforms. And for us, it means that now that some of these platforms are busy also integrating AI to do the job of these humans, it gives us an opportunity to investigate what kind of better work and more meaningful work could we offer to people who are working in these platforms. Again, in the traditional crowdsourcing model, we nastily sometimes reduce these people into a worker ID. So instead of 500,000 real human beings working on something, we have workers with IDs, and then we have a pool of IDs who are contributing annotation data for us. But because it's real human beings who are under the scene there, I think, and we see this as an opportunity to conduct meaningful health research based on human data from these people in these platforms, as they don't have any other meaningful work necessarily at their disposal. So this is the kind of opportunity that we are trying to tap into. If and when we have these AI systems, machine learning systems that are capable of replacing people in these platforms, they need something to do. And that something can come from us, researchers. Better paid, meaningful work to contribute to digital health research. So that's the opportunity that we are dealing with. And we think that you can use these platforms because you have access to millions of people across the globe to many kind of personalized well-being research, massive scale health insights in a really rapid way. Like, for example, during the corona pandemic, I remember some of these platforms were used to really rapidly gain experiences and what is going on the planet in different parts of the planet, because you have this, again, programmatic access to people through these platforms that were created for the purpose of big tech, but are not necessarily used in the best possible way by those companies. So that is the opportunity. Seizing that opportunity, the three layers that we are working on, data management, crowdsourcing tools, and end-user applications are then where we do our actual research. And let's start with a couple of example cases about data management. So it all starts with the premise that data is obviously precious. Data is very valuable, but people either don't care or don't have the opportunities to cash in on their own data. We just give it away for free. We don't even give it for research, even though data have a very peculiar characteristic to them. So if you think of a point of data, let's say that it's like your mobility trace from yesterday. Where did you go? What did you do? Your phone knows that. It sends it to the vendor, whoever built the software or the hardware, and the data gets stored somewhere, and it gets used to improve and offer you services somehow. Now, the same data, you can duplicate it for zero cost. You would be technically possible to just duplicate that data and give it to researchers. No extra cost involved anywhere. And at some point, the researchers would be interested in some of this data to actually pay you. So these kind of mechanisms are something that we have been looking at. We've been working a little bit together with this My Data organization as well. Not lately that much, but we started a thesis some years ago where we had discussions with My Data people, and also we have been doing research that kind of aligns with the values of this My Data organization. So if you're interested in looking into kind of more conceptual thinking or principles of what it would look like when data management was done from a really human-centric standpoint, this is a really great resource to study, at least. So mydata.org is a European initiative which has a lot of ties to Finland as well, so it's worth studying. In this context, we have, for example, been doing work. At the bottom of the slide, you can see a couple of references from our work. We have been, for example, looking into ethics and concerns that people have about data reuse. And the interesting thing there is that even though people know that a given practice is unethical, if they think that a given data management practice that is going on these days is unethical, I just don't care. So we always talk about this ethics as something that everybody is interested in, and it should be in everyone's interest and do things the right way. It's not. We might as well be honest. People don't really care that much as long as their mobile phone offers them free applications in exchange. So it's a really difficult problem, and sometimes you end up thinking whether you are doing activism or research here as well. Whether people need to care about ethics, or is it someone else who has the kind of moral superiority or authority over what should be ethical or not. There's so many shoulds in these kind of questions always that it's borderline annoying, but then again, as researchers, we have the luxury of discussing these things after we get some empirical data on how do people really see and perceive these things. Now, the second thing that we have been looking at lately is cultural differences in terms of what is, for example, private, or what do people consider as too private to share, or even, for example, ethical. So we are building this kind of data sets together with our collaborators in Japan that look into image data specifically and trying to build AI-based solutions to obfuscate some of these images based on cultural norms rather than a norm dictated by the developer of the system. So sometimes we take it so for granted that the way that we see privacy is the right way. But that's not how the world works. So it's really weird that we presume that somebody who is creating a camera application in the phone is somehow the correct person to dictate how the rest of the world should see privacy. So we're trying to build this kind of culturally sensitive, adaptive data sets that could be then used in training AI to understand cultural differences in privacy. So this is something that we're doing right now. And this, of course, is not just related to image privacy, but for example, let's take a touchy subject because we do some amount of work on mental well-being. What does it mean to be well? What does it mean to be stressed? It doesn't mean that if in Finland we have a certain cultural understanding of what is stress negative or a positive thing, that somewhere else in the world they should understand stress the same way. And this has implications for AI algorithms, conversational interfaces, everything, because they should understand that you cannot talk to people from the perspective of the developer of that given software only. So cultural differences regional differences. This is a big thing in acquiring and managing data that is then later on used for training algorithms. Second layer, data capture tools, essentially crowdsourcing tools. You don't need a data management layer unless you have mechanisms to acquire that data in the first place. So we are relying here on existing smartphones, like I said. So the modern smartphone is a bundle of programmable sensors. That is how I see it. And if you look at just a tiny subset of what everything is available in the modern smartphone, to capture programmatically and then to model as a data source, and you can of course combine these sensors as well. You can do bundles of sensors to build like some kind of a super sensor that encapsulates a subset of all the sensors that's available on the phone. So it's really just a sensor device. And we can get all that data to use in research. There are platforms that can be very helpful in this. In the past, we have been using this Aware platform, for example, which is, by the way, developed at the University of Oulu earlier in our center. We've been using this, which helps to capture mobility data, any kind of sensor data that you have available in the phone, but also subjective data. The beautiful thing about phone is that the screen is a touch sensor itself. So whatever you can build an application, essentially, it becomes a sensor in the vocabulary of research. And you can send things like experience sampling surveys or questionnaires or whatever that you then combine with the sensor data. And then you make inferences based on machine learning or however you want through that data. There's also CARP, the Copenhagen Research Platform, which is pretty impressive. I think it works with Flutter, so it's also a cross-platform framework for capturing data on your phone. So we have been exploiting these kind of toolkits for crowdsourcing this data from people. Then, of course, the challenge is to finding the right kind of crowd, but that's a more a practical challenge rather than a technical challenge. So these platforms are key. And then, of course, wearable computers. So Aura, which originates from Oulu, this has been really good device for us in terms of doing research. So we can have this very unobtrusive wearable device that captures accurate health data from people. And this data, of course, we can bundle it together with mobile sense data to get a really tight reading on what people are doing. And then using these platforms, we can start building services like, for example, we have been working with Parkinson's disease, mental disorders, elderly care, even cancer symptoms, because we can get an understanding what these people do during their normal daily lives. And then, for example, in the case of Parkinson's disease, we can build this kind of a simple game where people use their own smartphones in their everyday life, and they input, for instance, their medication schedule there, and then they have to use this drawing game, again, using the touchscreen that is a sensor. And we can build systems that, for example, detect when the effect of medication starts to wane or it's not so strong anymore, and it recommends people that, okay, maybe it's time for your medication again, or it can help inform the clinicians that the medication is no longer working as effectively as it can. In addition to Parkinson's disease, we have been looking at sleep and pain through some of these same methods as well. So if we have wearable devices, some of these are not actually even wearable, so there might be like a sleeping mattress that goes a bit more into the realm of ubiquitous computing in this sense, but who cares? So if you have like a wearable ring, and then you can combine that data with a mattress that goes in your bed, you can get really accurate data on how you sleep at night. And then, for example, if you combine that with some mobile sense data, so you make questionnaires to people, asking them to elaborate what was bothering your sleep, and you combine that, for example, with application use data, you get really interesting insights, for example, to what kind of applications should you be using so that you can sleep better. And usually we don't think granularly enough about this. So it's always just, okay, don't use phone, period, because that's a kind of major simple finding to communicate, but it's not that simple. So sometimes we find that, for example, if you use productivity applications or some kind of communication applications before you go to bed, you actually sleep better. Now, it's difficult to understand or explain sometimes why this happens, but you can always speculate that, okay, if you have some pending work that you haven't completed, and if you just crush it before going to bed, or you finish whatever you started, your brains will have easier time falling asleep because you know that you have done your work. So these are things that we have been also looking at the level of like building these new capture tools and then just exploiting those. These are like a bit more like individual research studies that are short term. Then we also do longer term work, and we try to release public applications for anyone to use. And this is, again, like a distinct class. I think this is the holy grail of what we try to do. So we try to build data management systems, new ways to capture that data and build proof of concepts. And then in the end, we try to release something for the general public so that everybody could benefit from this. Not just researchers or academics, but anyone with a given medical condition, for example. And the subheading there, I think, encapsulates my own thinking of that, because why would we even bother otherwise? It's nice to publish papers and give talks, give 6G talks, but in the end, the goal should be to build something that is real-world useful, at least at some point in the future. And in our case, we have the luxury of being able to build something that is useful immediately. So here is a good example. For example, we had this really interesting international, multiple different universities involved in this process and multiple different Parkinson's disease foundations across the UK and US, where we built probably what is the world's biggest crowdsourcing study on self-care for Parkinson's disease. So we collected all the different techniques that caretakers of people with Parkinson's disease and the people themselves were just listing and cross-evaluating different techniques that they use to manage their daily life with Parkinson's disease. We have been using the same approach for low back pain also, for instance, together with the Oulu University Hospital. And these systems look very simple sometimes. This is probably from one of the earlier prototypes where we simply offer people this kind of interface to find different techniques that they might want to try in their lives. And the curious part in these systems is always that we are interested in evaluating techniques from multiple perspectives. Now, if you think of, for example, that you go online to find ways to, whatever, heal your low back pain or manage your low back pain or manage your migraine or take any condition, you're going to end up in some online forums where you have a lot of different discussion, but usually there is only one-dimensional evaluation. It is either good or bad, indicated by lots of text, upvotes, downvotes, but that's not how human brains want to make decisions. Also, that's not how reality works, because sometimes you have a lot of money and sometimes you're broke. Sometimes you just want stuff that works immediately, but you don't care about the long-term effects. Sometimes you are in a more kind of fundamentally motivated mood and you want to find things that are long-term solutions. So our systems always evaluate these techniques from multiple different lenses and viewpoints, and that is where the beauty comes. So we can ask, for example, that find me a method that is cheap, doesn't require other people so I can do it alone, and works long-term. And it tries to find the best self-care techniques in that angle rather than just give you suggestions that, okay, try this. Then, one of the newer ones that we are dealing with is all kinds of mental well-being issues and maybe even mental health issues. We're mostly targeting higher education, as that is a very high-risk group of people, and also we have a lot of personal experience from higher education, of course, so it's a natural crowd or group of people for us to work with. Again, we are trying to work with our international collaborators in order to build systems that understand different geographics and different ways to understand mental health. And now we are also looking into conversational agents here. This conversational interactions, just talking with a computational system, is something that is very natural, and we are now trying to look into this. Examples of the kind of work that we have done is, for example, looking at what kind of personality should the AI agent have when it's talking to you about sensitive issues like mental health, and trying to just understand like how to best use these conversational interfaces in mental health work. We have bilateral mobility funding with the University of Tokyo in this theme, so we are sending junior researchers back and forth between our lab and the lab at the University of Tokyo to try to build mobile as well as web solutions that rely on conversational interactions and target mental health issues, specifically in the higher education community. We have nice data sets, which we haven't yet opened to the public, but we are building something on top of those ourselves, hopefully getting the first publications out this year. And I think that this will be something that is going to have a really nice impact within the next couple of years, as long as we just manage to roll out our systems to the general public. One of the unique challenges here is, of course, that generative AI is very risky. Even though you build good guardrails into it, there is still like a tiny marginal risk that it hallucinates something quote unquote funny or inappropriate in a context like this. So sometimes it's a bit challenging to do research on this front because you have to make sure that everything is secured and 101% ethical and safe. In this sense, sometimes it's also a bit annoying, to be honest, because it seems that companies are just launching their generative AI therapists with zero responsibility or care in the world, whereas we have to try to do everything pretty, in a way, less agile way. But of course, that's just how research goes. I have some other thoughts about this as well. So sometimes when we do this work, I'm left with the question whether we are focusing more on academia or activism or some kind of dreams, because by very nature, the fabric of how we have to do academic work is very different than what you can do in small companies or, let's put it this way, activism. Like I mentioned, the crowd workers in these platforms are sometimes working in really poor conditions. And when we, for example, write papers or conduct research on trying to improve these conditions, sometimes we get reviewer feedback on the lines that this is more activism rather than research. It is not your job to try to make the lives of these people better, because that's not research. But your job is to just find out and then let the companies manage it because it's their job. So there's very interesting tensions also when you're conducting this kind of research. Role of university. Our resources are quite poor compared to the companies who are actually manufacturing these wearable devices. They have all the data in the world. They have all the devices in the world. Some projects that we have had, we fight for them for 5 years. We get 400,000 of funding. And then you have the exact same idea. One-to-one exact same idea. Crowdsourced insights on health conditions. And they get 9 million for that to build that same service. So sometimes you're left thinking, like, what is the future role of university in this context as well? I'm not going to provide an answer for that, but this is very interesting research to follow and conduct also, because it leads you to these kind of bigger questions. What are we really doing, and what should we be doing in the future as a university? What can we contribute that companies can't? That's a big question. I think one of the things is that we can try to orchestrate this kind of human cognition. That's what we're trying to do. We're trying to build this programmatic access to human ingenuity, human genius, human ideas. And one of the things that we could try to do is build this kind of a more global way of orchestrating this information to help science. Of course, there are very many successful citizen science projects like Zooniverse, things like Wikipedia, that are really good at already doing this. But I think we're not there yet. I think there are ways to tap into the distributed intelligence of human crowds in far more efficient and effective ways that we're doing currently. The current model of getting funding for 3 years and then doing something else, that's not the way to do it. Of course, it's a holy grail problem. It's very difficult to solve, but that's something that we have been thinking about, how to solve it. Also, we do some workshops with industry itself on specifically making these platforms better. Looking at the problems that the workers have, trying to figure out what exactly do they want to work instead of what they have to work on. And again, this is very close to activism versus academia. But luckily we have very nice human-centric conferences that are very receiving to hosting at least these workshops together with industry, where we try to look at these problems from the vantage point of both parties, academia and industry, together with the workers. This is one example of also what we have been doing in the past and are still trying to do. With this, I think I'm pretty close to ending. I'm always happy to collaborate with people as long as we find some nice ideas. We have pretty extensive network of collaborators as well. So we work with University of Tokyo, Melbourne, Sydney. A lot of universities in Australia that we work with, Denmark and also Hong Kong. I would be very happy to work with more people also locally here in Finland, especially in Oulu. Sometimes I feel like we have pretty thick walls even between the same faculty or the same city. So I'm very happy to accommodate any discussions or collaboration that we might have. We have a couple of Academy of Finland projects that still run for a while on this same topic. So at least we are not disappearing anywhere quite yet. So I look forward to getting your discussions with me, and let's try to build something together. Thank you.